So today's talk will be the scientific basis of acupuncture. And of course, in Integrative Medicine program, we have many services. We have Integrative Medicine consultation, nutrition consultation. We have IV micronutrient therapy. We have head acupuncture now. We will be ramping this up in even hopefully bigger scale. So I'll talk about the review of history, mechanism, and evidence of scientific basis of acupuncture. So acupuncture originated from China, and it has been widely used in China, Japan, Korea, Vietnam for about 2,000 years of documented history. I say documented history because that's about 2,000 years ago is when mankind systematically documented using paper, not clay, not in carvings in stone. So, and the commonality of those four countries spread out quite long over geographic distances is that they all use Chinese characters. And that's significant because Chinese characters means that they imported the culture. Like right now, important science journals are in English, similar kind of phenomenon. So it was introduced to the U.S. To the public by NY Times reporter James Weston, who was part of the entourage to visit China with Nixon, who recounted his experience. Imagine going to a country that you're not familiar with. Maybe that was more than 50 years ago, or about 50 years ago. Go to a country, you come down with appendicitis. They do surgery on you, and then you survive it. You open your eyes, and you have a lot of pain, and you say, I need some pain control. And here comes doctors rushing in with needles, acupuncture needles. Just imagine from his perspective. So he said that it worked quite well for him, and he wrote a article about it and published it in New York Times. And I think that's when public began to pay attention. So today, fast forward to today, we have about 3.1 million U.S. adults and 150,000 children have received acupuncture treatments. And this is the data from 2007 National Health Interview Survey. And that's about 11 years out. So these numbers, I guarantee, will be higher, not lower. So who provides acupuncture? It really depends by the state legislature. Now you have a physical therapist able to do dry needling, which is a form of acupuncture. I'll talk about that when I talk about the connection of acupuncture and Dr. Osler. Physician acupuncturists, most states now have licensing non-medical route known as licensed acupuncturist, which is designated commonly LAC, which require typically a master's degree. There's a movement within acupuncturist community that they're looking at turning into doctoral degree, and what that doctoral degree often does is specialization. So that master's degree for general licensure and doctoral degree for further specialization. So some of the specialization they have now, the most famous one is the infertility for reproductive medicine. They have their own program, they have board. Doctoral degree is not required, but the general direction seems to be heading that way, at least when I was the Dean of Acupuncture and Integrative Medicine College in Berkeley. So the other professions that have access sometimes is naturopathic doctors and chiropractors. And it all depends on state licensure. And there are even states that physician acupuncturists are prohibited to do medical acupuncture because the LAC community is so strong. They lobbied the state legislature and changed the law. So this is like one slide that kind of covers many things. So the left side is the yin and yang symbol, and this is less known, what they call 5 element or 5 phases. And in a way, it's relevant, in a way, it's not, because it's relevant because these are ideas, paradigms, and as such, they're wonderful tools to have, but in strictly from scientific view, not so useful, because yin and yang, though, is our computer system, binary system. the Chinese were thinking about can we view the world through a binary lens? And that's what they created. And some of you may remember the first time when we had computers, we had black and white or green computers. So basically black and white. And then we got RG, green, red, green, and yellow, primary colors for light. So, and out of that, you can create impressive graphics now. And you can do amazing things with computers just by binary. And it's a similar kind of idea, except they came up with it about 2,000 years ago without aid of computational tools. So for everyday practice, I would say this is not as important. This is an example of channel, acupuncture channel. A lot of study has gone into identifying the channels and really cannot explain an anatomic feature as such. So I look at it as a historical reference of development of acupuncture. Chinese medicine has 4 branches, and acupuncture is one of them. They have other branches. This is a picture of Yang Jiangfu, a Tai Chi master. But for Chinese, Qigong, Tai Chi is a form of medicine. They consider it like exercise, sports, medicine, rehab rolled into one. This is a picture of artemisinin, which Nobel Prize was, I think about several years ago, a Chinese professor won a Nobel Prize in her work of artemisinin and malaria. And she got the inspiration from a classic Chinese text saying that you can treat fever with this. And he said, anthropologically, what kind of illnesses would have existed in that area? Malaria, fever. And then she said, I'm going to dedicate my life to elucidating the mechanism, characterization of why this herb works. And for that, she got Nobel Prize. This is a picture of acupuncture on the hand. And then, of course, they have tuina, which is a form of massage. But it's not the level of massage here where anyone, I think high school degree, I'm not sure even that's required in some states, but anyone can become a massage therapist. In China, we're talking about, and they have that version too, but you have medical massage or tuina that they look at as a physician specialization. So you can go to Chinese medical school and get the similar or same curriculum as a Western doctor, but then at the end, you will say, I want to do herbal medicine, I want to do acupuncture, I want to do medical qigong, or I want to do tuina, which is manipulative therapy. So in Western paradigm, we have trigger points. Dr. Travell has spent her lifetime documenting trigger points, how to treat pain using the trigger point paradigm. And those are hyper irritable spots in the fascia surrounding skeletal muscle associated with palpable nodules in taut band of muscle fibers. And there's a very strong correlation of locations of trigger points and acupuncture points. Some study document 92% correspondence of acupuncture points. And if you just go by pain, about 80%. So is it possible that if you look at all these things separately and not take it as a whole, accepting TCM and it's what the philosophy is about, is it possible, just objective point of view, that the acupuncture points have to do with pain and trigger points? William Osler, I was amused. I think there's an Osler commemorial event going on in the campus. So when I was preparing for this talk, I found this, and we in medical acupuncture know about this. This is from Sir William Osler, Practice of Medicine, published in 1892. It says, for lumbago, acupuncture is, in acute cases, the most efficient treatment. Needles from 3 to 4 inches in length, ordinary bonnet needles, sterilized will do, are thrust into lumbar muscles that are at the seat of pain and withdrawn after 5 or 10 minutes. In many instances, relief is immediate, and I can corroborate fully statements of Ringer, who taught me this practice, as to its extraordinary and prompt efficacy in many instances. So today we call this trigger point dry needling acupuncture, or dry needling, period. So my point here is that Sir William Osler did not write about Chinese medicine. He just look this as a medical procedure that you can do without subscribing to the integrated philosophy or history or theory of Chinese medicine. That means that medical acupuncture can be a procedure unto itself without subscribing to Chinese medical ideas or principles. The proposed mechanism of action, the first one that I'm very familiar with and got me, its study has brought me to many branches of other sciences that I have active research interest, is endorphin model. So basically, scientists have done trials where they do acupuncture and they can document increased endorphin levels when treated with acupuncture. So of course, we have opioid receptor antagonists, naloxone, naltrexone. So when you give those, you get a blockade effect. And so some people said, hey, is it possible that endorphin model is involved in acupuncture, how acupuncture works? And I would say partly. There's also neurotransmitter model that increased production of serotonin, norepinephrine are documented in the CSF of animals with acupuncture. So we're talking about needles being inserted into distal points or within a lot of the peripheral nervous system, affecting changes within central nervous system, and documenting that biochemistry. The last model, the first listed, is the gate control theory, where specific nerve fibers transmit pain signal to the brain via spinal cord. Acupuncture treatment is thought to inhibit the pain signal of transmission. I think that has some truth to it. One theory that I have not listed is my own theory. It's an observation, and it's a combination of endorphin model, all three theories. It seems like acupuncture, when done through neuroanatomical practice, you are able to, in an effect, reprogram some of the pain experience an individual is having. So for example, endorphin model is best accessed through electric stimulation. If you do electric stimulation of low frequency, about 2 hertz to 4 hertz, then you can get an endorphin response, which is not only sustainable, but it has a cumulative value over time, which is the reason we recommend 6 acupuncture treatments at least in the cancer acupuncture world. 6 treatment is considered a trial. And if you haven't done 6, usually 2 treatments per week for 3 weeks, then you haven't successfully done a trial. So you don't know acupuncture works or not. So folks who come to my practice and say, I want to do 1 acupuncture treatment, I want to see if it works. And I tell them, don't waste your money. 6 is literature standard. If you want the experience of saying, I got acupuncture for relaxation treatment, that would work. But for serious pain, not so much. And the literature also says that really depends. If you have a patient who is narcotic using, yesterday I had a patient that the patient has to get off narcotic pills by, I think, next month or in 2 months. And he said, I need your help. I need your help. And so in that case, I told him, you need to come 12 times just to see if it works. And you'll have to come almost every day. And we'll have to adjust or get the idea of how that is going. And once pain control is adequate, then you'll have to start talking to the other doctor, pain control doctor, to lower the amount of medication. So endorphin model, I can say that it has basis theoretically and practically, and I can modulate this by doing electric stimulation. I think that for those of you who have interest in pain management or pain, there is a procedure called percutaneous electrical nerve stimulation. Usually, those are done before the dorsal column stimulator or other kinds of spinal cord stimulators are inserted to just document efficacy. Does it work? Does it not work? But we can use acupuncture to actually simulate and perform percutaneous electrical nerve stimulation, which was developed extensively by one physician, Dr. William Craig, who ended up being the president's acupuncturist for George Bush, the father. The neurotransmitter model also has merit, especially treating any psychological or emotional basis. This was first described in Beijing. Beijing protocol is very simple. Everyone can do it. One needle between the eye, one needle kind of top of the eye, connect those two with electrode, stimulate. And then what we can see is that you can lower the doses of tricyclics, because that's at those times we didn't have SSRI. So that observation actually came from UCLA and McMaster's University in Canada. So when I was taught this, Dr. Linda Rapson, who was on the faculty of UCLA medical acupuncture course, said, I have noticed this, that if you use electric acupuncture in these 2 points, you can reduce the dose of tricyclics, and in a few cases, even patient says, I don't want to take them. And I think that, unfortunately, when they did clinical trials for depression, they didn't read about this. They went at it as black box theory, that Chinese medicine is special, that you can't use protocols. We're going to individualize the treatment. So at the end of that, I can share with the result that it was a failure. And I'll get to that. About 30 papers, I think, almost daily get published on acupuncture in 2018. A lot of papers coming out. And despite all these papers coming out, the field is, the evidence basis is still very cloudy. And I'll talk about that as well. The types of acupuncture, I kind of divide into 2 categories. I think that there are practitioners who subscribe to traditional medicine theory. It relies on unproven medical paradigm involving qi, which is their version of energy. And I collaborated while I was studying with Dr. Andrew Weil in Tucson for 2 years. I also collaborated with Dr. Gary Schwartz, who had an NIH 5-year frontier center to investigate, if you will, paranormal activities involving healing. And he did all kinds of interesting projects, but the one that I got really involved was, can you characterize, can you document this qi that Chinese culture, Korean culture, Japanese culture have been using for thousands of years? The end result is not very reliable. And as you know, in science, reliability, validity is trickier, but reliability, if you don't have reliability automatically, you can't have validity. So neuroanatomical acupuncture is what I practice. Neuroanatomical acupuncture has many names: rapid acupuncture, battlefield acupuncture. That's because one of the most contributors of the field, founders of the field, Dr. Richard Nimzao, is a retired Air Force colonel with Air Force, and he has actually created this protocol using neuroanatomical points to reprogram the central nervous system. And that in my practice, that involves scalp acupuncture. Why scalp and ear? Because scalp and ear it's a technical point, but they bypass the spinal cord. By definition, they're part of CNS. So the acupuncturing of scalp and ear bypasses spinal cord, thereby bypassing the middleman. It's not subject to modulation. So there are points that are designed to access thalamus, which is involved in pain. There are points that will target what's cervical ganglion, stellate ganglion. Now, if I had access to functional MRI, guess what I'll be doing? It'll be a great research project to document. And some of this research is being done by Jang-hee Cho in Korea, who used to be in UC Irvine with functional MRI. He's the guy about 10 years ago that he discovered that if you acupuncture your feet, which governs eye issues, you can make occipital lobe light up in fMRI. And that was actually cover of Newsweek for some of you who may remember. So the other part I talked about, the TENS acupuncture and trigger point acupuncture. So evidence-based medicine and acupuncture, it's talking about And this is a development of evidence medicine and medicine, 1990s, David Eddy, and then Gordon Guyot and David Sackett. Consensus, explicit, and judicious use of current best evidence in making decisions about care of individual patients. It means integrating individual clinical expertise with best available external clinical evidence from systematic research. And I think that's a big difference between folks who do neuroanatomical acupuncture and traditional acupuncture, is that to us, our subscription goes to evidence and what the evidence. So when I design treatment, it's about scientific plausibility as well as studies done showing what protocols were used to do what. So a lot of my treatments actually come from literature. And when I run into problems, Medline is the first place I go and start searching. This is the American College of Physicians guideline, practice guideline that was issued through Annals of Internal Medicine 2017. It says, given that most patients with acute or subacute low back pain improve over time regardless of treatment, clinicians and patients should select non-pharmacological treatment with superficial heat, massage, acupuncture, or spinal manipulation. So it's out there now, saying that we should really use these modalities as first-line therapy rather than using it as an alternative or last resort treatment. And this is from coming from a clinical guideline, practice guideline perspective. And I'll touch on the greater implication for acupuncture for pain control in my later slide. So there are a lot of evidence in acupuncture. Acupuncture probably has more evidence basis as a modality than even compared to a lot of surgical procedures. And there's probably more than 1,500 randomized controlled trials, but there's conflicting results. And one of the things is what I call non-specific needling effect of acupuncture. They like to call that sham acupuncture, but there's nothing sham about a needle being inserted into your body, right? Guy coming with needle, it's like, okay, I'm gonna insert it. So in a way that, what translated other way is that what Dr. Osler observed is correct. If you needle any part of the body for any problem, about 40% should get better. That's astounding. That means I can take anyone in this room and say, okay, I'll show you how to do needle insertion or robot, you'll get about 40 to 50%. Now, as a clinician, if I have a protocol that works only 40 or 50% of the time, what's that? That's placebo, right? That's not really effect driven. So when you practice acupuncture, you have to know that. So when your patients get better about 40% of the time, you have to ask, is this protocol any good? Many existing studies do not take account of different types of acupuncture. The fallacy. If you read an article, medication found to be effective for treating hypertension. What's the problem with that? How about like operational definition? What medication? What dose? How long? How about the target? So when the brilliant scientists study acupuncture, they just kind of forget about the basic science they have received. And I think part of that is it's getting better because the people who have kind of feet in both worlds are getting involved with research. And I hope to get involved in research here as well. Publication bias. We have Sarah Astorga, Integrative Medicine Fellow over there. She's our first KU medical acupuncture course recipient that we're developing together and being trained. And what I can say is that I've taught her that there's a publication bias. If you find some authors' names, I won't mention them, but you don't have to read further. It'll be negative results. If you read other authors' first name, last name, guess what? It'll be positive results. And one time I did a review article and on back pain, there were already very well done meta-analysis, technically very well done. Some same database of RCT articles. This was done about 20 years ago, so not a lot of articles available then. Two great groups did the study, right? Meta-analysis, two different results. One says it doesn't work, one says it works. So that's kind of we are in evidence-based medicine. The variability of studies, inconsistent systematic reviews, even using a database, design failing to match appropriate conditions to treatment. So this is really, pharmaceutical industry never ceases to amaze me in how smart they can be. Because when St. John's wort was really big hit, they were seeing numbers declining. So you know what they did? Pfizer, I think. They funded a study. They knew that would fail. St. John's wort fails to treat major depression. Now, those of you who may have an interest in psychology, major depression is not easy to treat. Even using medication, we have failures. So they picked out, but that was in the news. It's so clever. And after that, I'm told that the St. John's wort sales went down and SSRI sales went up. So acupuncture for chronic pain, individual patient data meta-analysis. So I did say that, so I have to disclose that Dr. Vickers is one of the people I think believes in acupuncture or has seen acupuncture. So as you can probably guess, he will say acupuncture is effective treatment of chronic pain, therefore reasonable referral option. Significant differences between true and sham acupuncture indicate acupuncture is more than a placebo. However, these differences are relatively modest, suggesting that factors in addition to specific effects of needling are important contributors of therapeutic acupuncture. That's what I've been saying, and that's what I tell Sarah, is that if you know the literature, you know the base, what we call signal to noise ratio, you know what the noise ratio is, then you have to make sure that your protocol is way above. I like about 2. So 80% means about 2 times signal to ratio. 100% is not achievable. And if anyone tells you something works 100%, run away. Or run to that person and learn their secret. Become rich and famous and win Nobel Prize. This is the value of acupuncture in cancer care. Dr. Weidong Liu is a physician trained in China and has a master's of public health. And he is with multiple institutions such as the Dana-Farber Cancer Institute, as well as Zakim Center for Integrative Therapies in Harvard. And basically, he and I view things pretty much very similar way, is that why is it that human acupuncture doesn't work? Because we don't like to stimulate people with electricity. And when we do electric acupuncture experiments on animals, we go ahead and stimulate them very vigorously. Well, people, you start doing that, they run away. They don't come back to you. So it's just easier maybe not to stimulate. So in his clinic, everyone gets stimulated, everyone gets heat treatment. And heat treatment, we're not talking about like a little bit of heat. We're talking about pushing the limit until patient says, ow, that feels like it's burning. Why is that? Because we want to induce heat shock proteins for healing purposes. And in China, in Korea, in my private practice in Georgia, we did very limited also direct, very, very controlled moxibustion direct on the skin, leaves a little bit of mark. But for patients who are in acute pain crisis, amazing results. And the master of that lives in Korea, and I think he's 100 and still practicing. And he says, and when you talk to him, he says, you know what he talks about? He talks about heat shock proteins. Heat shock proteins and how heat shock proteins can reset the pain response because, and he says that getting, if evolutionarily speaking, being skewered by a sharp object that goes in more than certain length is against our survival odds. Being burnt alive is against survival odds. So he said that we have mechanisms that have vigorous response to assess and correct those problems and remedy it. And that was that's his theory. And coming from someone who was born and practicing still acupuncture, you can see the future direction of acupuncture. Actually, even stout people who are educated in traditional Chinese medicine are beginning to say, hey, we have this science, it's going forward. Let's learn from science. So the value of acupuncture in cancer care, that's what I did in my last job as the medical director of Integrative Medicine at Miami Cancer Institute, is a lot of acupuncture. Depression, anxiety, hot flashes, fatigue, neuropathy, insomnia, radiation-induced xerostomia, and acupuncture for palliative care. Actually, palliative physician and I were trading patients on daily basis. They would escort people to me, I would escort people to them, because there's failure rate built in. And Bayesian logic, I think, is a very useful tool to look at things like integrative medicine, because you want to assess the prior probability of success, because if the patients have been to a series of doctors or modalities and they failed, your prior probability of success on those patients is different than taking all comers. And this is an example of the latter, last resort. So Richard Nimzow, who is a radiation oncologist by training, developed a protocol apropos to his profession, radiation-induced xerostomia. And basically, very, very simple and elegant protocol. You get like 6 needles inserted to you, and that's it. And people start salivating. It's like one of the most fun acupunctures you can do, because it works if you learned it from Dr. Nimzow and didn't modify his protocol. It's reliable. Not on everybody, but that trend is there. So he shared, I mean, this is also one thing that's different than traditional Chinese medicine. Everyone had secrets and didn't want to share them. So Dr. Richard Nimzow is MD, MPH, PhD. So he did something that probably most academics would do. He shared his protocol with anyone who wanted it. It was in the website. And he shared it with MD Anderson, and MD Anderson said, great, we'll test it with our acupuncturists, our clinicians. Say, oh my God, this thing seems to work. So what they're doing now is 2 phase 2 trials using xerostomia, 1 to treat xerostomia and 1 to prevent xerostomia underway right now. So Mountain Home VA reduces opioid prescriptions by 49%. And so this is now they're using acupuncture therapy and yoga. Having said that, it doesn't work 100% of the time. Like the patient I saw yesterday, unfortunately, is in the position of losing the support of narcotic and almost forced into this arena. But I fear for such approach, because you have to have safety net when you're treating patients with pain. So I'm in the process of getting him referred to our pain clinic at KU. The role of acupuncture here in KU Integrative Medicine, first thing I'm very interested is in pain and non-pharmacological management of pain. I'm going to be meeting with Dr. Daoud Saeed. He is, I think, Chief of Division for Chronic Pain Management with the Department of Anesthesiology. I'm hoping to maybe do research with him, his division. Another interest of mine is neuropathy, because once you have neuropathy, we don't really have a lot of tools that are effective, and narcotics do not work on neuropathy. That's kind of my thing. It's like, do you have burning pain? Because neuropathy, probably that's most sensitive pain, is that do you have burning pain? If you have burning pain, to me, I have to suspect nerve irritation or nerve injury. Another variation of burning pain, this is less well known, is crushing pain. Do you feel like like pressure? You're being in a vice. Then you have to suspect also nerve involvement. Fatigue is really hard. I think that anyone in integrative medicine knows. If neurologists, I think they really are not happy to see a day of schedule full of dizziness patient. You know, there can be a lot of differential diagnosis. For us, it's fatigue. It's not easy to treat. There are many causes that can cause fatigue. One of the things that we do see, I have had success, is depression, anxiety. And I don't mean alternative treatment. I'm talking about treatment to improve their quality of life, and some patients, a few patients, can reduce medication or lower it, and especially with supplementation support. And xerostomia is, like I said, it's a very, very fun thing to do. Research interests include, for me, when I was in Miami, I was just developing a protocol, acupuncture for treating taxane and platinum-based neuropathy, and I have meetings with the Cancer Center to discuss collaboration clinically, maybe even research. And then integrative pain management is an interest of mine. and combining neuroanatomical approach with massage, herbs, low-dose naltrexone, and mind-body techniques. And last slide, integrative oncology. This is where the field is moving towards. This is a clinical practice guidelines on evidence-based of integrative therapies during after breast cancer treatment. So this paper, which is available either through library or just direct download, is organized modalities in integrative medicine and looked at them like U.S. Preventive Services Task Force did and graded them. So pretty much you can see what has evidence base, what doesn't have evidence base. I think that's my last slide. And if you have any, and this is the Integrative Medicine Consortium, and one of the many things Dr. Driscoll did was that she was, I think, steering committee of this group for many years, and University of Kansas is a member, and other members include some of the most prominent medical schools and communities in the world, including Harvard, Duke, Yale. So, and they're talking about, they have an initiative called Moving Beyond Medications, and these are evidence summaries for treating pain: acupuncture for cancer pain, chronic pain, post-op pain, acupuncture therapy for acute pain, and other modalities, chiropractic, the massage therapy for chronic pain, acute surgical pain, Tai Chi for pain, yoga for pain, movement therapy for pain. So I think that we're going to see more and more pain, alternative ways of dealing or controlling pain adequately. So I think that this field is actually booming, exploding about, and part of the thing in this area that integrative medicine, we are in the forerunner, and University of Kansas is top 3, I would say actually #1 institution when it comes to IV micronutrient therapy, thanks to Dr. Ginny Driscoll, who is now has done research, is doing research, and taking up to the next level through applying for NIH funding. So that's the end of my presentation. If you have questions, I'm happy to address them.